Dr. Rathauser, could you share how Dr. Habib Davanloo, how his teaching influenced you both personally and professionally?
Well, I think the starting point would be to talk about what I was doing before I actually met Dr. Davanloo, because I had been trained psychodynamically in graduate school, was very much influenced by my early readings of Sigmund Freud and some of the other analysts at the time. And part of my tradition was believing that long-term therapy was the only real solution for helping people who had long-standing difficulties. The idea that something that took a long time to create could not be changed in a short period of time. That was the thinking that many of the analysts had at the time. And so it was my history of coming to meet Dr. Davanloo was interesting. It was in the mid-1980s that I was visiting my closest friend from graduate school who had been training with Dr. Davanloo. And at the time, Dr. Davanloo had a core training group in Southern California. I was visiting with my friend and he said, "I'm taking you to San Diego to see Dr. Davanloo." I said, okay. It didn't mean anything to me at the time. I attended a one-day presentation and it did not influence my thinking at all because I was really not able to comprehend what I was seeing when I was watching him work. It was around 1992 or 93 that I actually went through treatment with ISTDP for myself and with somebody who had trained with Dr. Davanloo. And it opened up an awareness that all of my years of therapy had really done nothing to help me personally. But 40 hours of ISTDP made amazing changes. And so with that as part of my new excitement, I went to New England. I think it was somewhere in Vermont or New Hampshire, where Dr. Davanloo was giving a 3-day conference. And I sat there and my mind, my eyes opened up wide and I could not believe what I was watching. I was seeing people transformed. So I approached him at the end and I said, "Is there any possibility of coming into training with you?" And so we talked and he liked my friend who had trained with him. So that was on my side. And because of my association with my friend, he agreed to take me in for training. It was 1994 that I began core training with him. And the core training lasted for 8 years until 2002, when I ended being a part of the core group. But I continued through 2016, going to his annual metapsychology conferences in Montreal. So that was the beginning of my adventure with Dr. Davanloo, and it changed every way in which I thought about treating mental health problems and relating to patients. It was an entirely different understanding.
Well, first impression when you saw ISTP, once you saw Davanloo at work?
I was absolutely fascinated. And I had two thoughts. One was, nobody will ever be able to do what this man does. And the second was, if I can learn to do anything similar to what he does, I can help people. And I still think of it this way. He was the most brilliant clinician I've ever seen. There is nobody who had his genius. He created this. I mean, he was our leader. We followed him, but without him, we would not have been there. There would be no Warsaw Conference. There would be no IEDTA conference. He was the genius who inspired all of these people who have been putting in all this effort to try to learn his technique. I was able to let go of psychoanalysis because I just saw it as something I had to remove from my brain in order to be able to do ISTDP effectively. And I loved it. It allowed me the freedom to be able to be more emotionally connected and to have a lot more freedom in terms of being able to be spontaneous and give up the passivity that was part of the psychoanalytic position. You know, what psychoanalysts called active listening, which to me meant that the analyst wasn't even communicating with you. And I found that to be very traumatizing personally.
What was the biggest change for you once you entered ISTDP?
Well, I can tell you, Dr. Davanloo spoke about this in the training, and he said that he believed that people who had been trained in psychoanalysis were kind of ruined. Their ability to learn his work was going to be diminished because they were so influenced by psychoanalysis. But I think that argument was really not quite correct because he had been an analyst. All of the early pioneers in brief dynamic psychotherapies had been analysts. They were developing new models of treatment like Sifnios and Malin, Louis Wolberg, who was the head of my psychoanalytic institute. All of these people were very, very creative in their own different ways, but none of them were able to accomplish what Davanloo did. Davanloo would say, if you've studied psychoanalysis, you won't be able to learn this. It didn't create that kind of an obstacle for me. I was able to get my brain to put psychoanalysis to the side and say, I really don't want it anymore.
During our last supervision, you mentioned about combining ISTDP with other modalities. It was very interesting to listen once you told, if you do ISTDP, don't use, for example, journaling because this is kind of a resistance against closeness. Could you elaborate about just connecting ISTDP with other modalities?
I have a personal belief that you can't do it effectively. And there are people who might disagree, and I'm sure they will, and they'll argue that it's possible. But I think especially anything that emphasizes working on a more cognitive, intellectual level will decrease the level of pressure that you're able to utilize in ISTDP. It will decrease the focus on the affective component of the work. And you're teaching people to intellectualize, which works against getting to core emotions. So I don't see that as being compatible. Try to integrate psychoanalysis. And I think that you can use psychoanalytic concepts as concepts, the pathological superego. But how we work with it is entirely different because psychoanalysis, at least during the years when I was training, they didn't have the tools that were needed to be able to effectively work with resistance. We simply didn't know what to do with highly resistant patients. And I remember the biggest weakness was dealing with people with what were called panic disorders, which I always thought were really anxiety attacks. We did not have the ability to know what to do with because nobody was teaching us about the different pathways of unconscious anxiety. Nobody was talking about how to create multidimensional structural change and about the importance of being able to take a psychic structure that had been damaged by trauma and strengthen it. And that system was complete. It gave us all of these tools to work with. And so that was one of the things that impressed me at the beginning. He was really showing us a very different way of how we understand psychic functioning, how we work with it, and nothing was missing in terms of the pieces that you needed to know. You just had to learn it, which would take years.
Many years, and probably the best way to learn is to watch tapes of our supervisors, your tapes, yes. Therapies that are more advanced. That's the only way to study ISTDP.
I agree with you. It is the only way. No one can read a book and learn how to do it. And especially because you need somebody who monitors how your unconscious is working as you're being trained. You can't do that for yourself.
You have to rewire the way how you are looking at the patient, and also you have to learn a lot. For example, we were taught to follow the patient, to follow the content. And also during class supervision, you mentioned that it's not the focus on the content.
Sometimes, I've had situations where I ignored the content and I just simply stayed with pressure and challenge, and I would be able to get a breakthrough or an unlocking. And at the end, the person would say, I never talked about what felt so urgent at the beginning that I came in wanting to tell you about, but it doesn't matter. It's all okay now because you got to the inner conflict without having to go through the content.
So what should we follow if not content and patient?
Well, I think what we have to follow is anxiety pathways. I think that we follow, for most patients, we're looking at the immediate nature of the tactical organization of the resistance that presents itself. If you're dealing with somebody who is more fragile, you're dealing, of course, with a different set of mechanisms. You might be dealing with dissociation, with depression, you're dealing with the repressive mechanism. But most people have at least some degree of tactical defense that starts to show as the early manifestations of the resistance. And that's what I focus on. You might say, could we look at what are the difficulties that you want help with? They say, well, I may have a problem with such and such. And you say, so you may have a problem, you mean you're not certain. So we start to work with the indefiniteness, the vagueness. But Dr. Davanloo really identified hundreds of different types of tactical defenses. And so if you take the time to really read and integrate and start to recognize them in a very immediate kind of way, then you can begin these early forms of pressure on the defense. Or you might pick up something very different, which is that the person really doesn't want to be there, which sometimes is hard to identify. But if you don't understand that, you don't have a patient to work with.
Coming back to Dr. Davanloo, you knew him quite well. He passed away. His tapes lost, but not yours, not other colleagues that studied with Dr. Davanloo. You'll be able to see your tapes during the Warsaw Conference.
I'll be showing you tape, as will other people at the Warsaw Conference. And so we all get to see different ways of how we work with the system. Dr. Davanloo's tapes, unfortunately, I don't think will ever be seen again because there are legal issues. And I asked him about this at one point, and he wasn't even sure whether he had the legal ownership of the tapes or whether it was the university system, the medical system. And he said he was going to speak with a lawyer and find out, and I don't know if he did, but it doesn't matter either way. The tapes were, the patients would sign an authorization for him to use the tapes for teaching and training purposes. And that means that when he no longer is here, the tapes can't be used. This is the way it works. I will make sure that in my will, it will be known that my tapes must be destroyed when I die. It has to be that way. And I don't see any way around that other than the possibility of using artificial intelligence to try to replicate some of these sessions.
Yeah.
And I am actually speaking with somebody now about that possibility. Could be that you can recreate a session and the patient is not recognized.
So this is the way. And the only way is to see as many tapes as possible, to see your tapes, to come over to the conference, to see tapes of our colleagues. So we'll be able to sit in one room and watch each other tapes and to look and to assess and to think about what's the difference, what's the similarity. And I do hope that we'll be able also to speak about Dr. Habib Davanloo. When you met him personally, what's your impression? What stood out to you the most about him as a person, clinician, as a supervisor?
I think it starts with the understanding that he was a very complex man. And I don't know that anybody ever really knew Dr. Davanloo on a deep personal level. I mean, I had many, many occasions to sit with him, to talk with him, to train with him. But the only person I knew about in his early life was a grandfather. He spoke about the grandfather who would take him into the mountains in Iran, and he became fascinated with the wild animals, and he developed an interest in the primitive nature of life, but never heard about his mother or father or grandmother. And I met his wife, who he divorced. They were divorced ultimately. So I met her. She was a lovely woman. And then he had two daughters that I had met. What was it like to be with this man? Well, first it was being absolutely inspired by his genius. I sat there in awe of what he was doing. And I could watch the tapes over and over again. And some people would say, I've seen it already. I said, no, you need to see it many times, because if you're really learning, each time you see it again, you will integrate more and be able to have a deeper awareness of what he was doing. But for people who think you only see it once and that's it, and that's all they need, they're not understanding what this is really all about. Like many people at the very beginning, I remember I sat there very frightened of him, very frightened of what I believed would be his critical nature. And that was more a problem with me than it was with him. Many people felt the same way. That some people left training because they said, he's too difficult, he's too demanding. To me, he was like a critical, punitive superego figure. But once I understood that my projection was getting in the way, I was able to see him as a very compassionate man who really wanted to teach. And it was very interesting to learn that the people who he was most critical of were the people he believed in the most. He believed that you could learn and integrate. And sometimes he would simply sit there and do what he called chit-chatting with people. Never saying anything negative, never saying, this needed to be done in a different way. I think he had given up on those people, which I think was his failure, because he could have helped more people if he had done it a little differently. But as a teacher, he was only a mediocre teacher. He was not a great teacher, in part because I don't think that he always knew how to explain what he was doing. It took David Mallon to explain what he was doing. And that's something we didn't know at the beginning. He wrote about how he would do the work, he would tape the sessions, and then for years he was trying to look back and explain why he was doing what he was doing. And was he ever able to understand what he was doing? I think David Mallon was able to work with him to put it into a deeper conceptual theoretical model. And so many, many times I learned the most by watching his tapes, not by what he said. The tapes were just so brilliant. And after a while, when you start to learn the basic metapsychology, then your unconscious can start to put together what you're seeing and make sense of it as you're watching the tapes.
Thinking about conference, Alan Larson promised us to bring from his own private library several vignettes of interesting discussions with David Mallon.
I watched the conference that Rob Naborsky had that was from the early 2000s, and with Dr. Mallon's wife, and Patricia Coughlin was there. And I actually was able to ask a question of Dr. Mallon's wife, because I was learning for the first time that Dr. Mallon was the one who wrote all of the articles.
Yeah.
Okay. Now, this is not unusual. In universities, the professors have the students write the articles, but the professor's name goes on it. I think it's absolutely unethical, but I understand it's the tradition. But Dr. Davanloo, his command of the English language was not great. So many, many times people would ask him questions and the answers that he would give you weren't helpful. People started to laugh about this. They realized it was kind of futile to ask him questions.
Over the years, you've been deeply involved in ISTDP. Could you walk us through some of the highlights of your work during this time? Which moments have been most significant for you?
ISTDP is primarily what I do in my private practice in New Jersey. Ever since I began to learn the method and started transitioning from psychodynamic work to ISTDP, it was a slow transition over a few years. But then I got to the point where I was becoming more and more comfortable and had a deeper understanding of the work. And so in my private work, it was almost exclusively ISTDP. There are some people I have who don't respond well to it. They're more damaged usually, so they become longer-term patients. It's like anything else, there's no form of treatment that is suitable for all people. It doesn't exist. But I love the beauty of ISTDP when it works, because when it works on a level that nothing else does. And you see people change very dramatically. I was always reluctant I never really felt early on that I was prepared to teach. And maybe it's always what I refer to as my narcissistic deficit. I didn't have enough faith in my ability to go out and help people to learn in a meaningful way. So that all changed when Dr. Davanloo walked up to me in Montreal one day, and there were two women with him, and they were from Pennsylvania, which is next door to, well, one was from New Jersey, one from Pennsylvania. And he says, Dr. Rathauser, he introduces them. He said, they want to learn this work. They cannot come to Montreal. You will teach them. And I looked at him and I said, Dr. Davanloo, I am not ready to teach. He said, you are and you will. So it was a very memorable moment. And I was very grateful because I came to love the teaching. It became a major part of what I took the greatest happiness from. And so over time, I was training more and more people individually, but then I started getting involved in running core training groups on the West Coast. First one was in San Francisco for a year. And then I was in Los Angeles for, I think, close to 10 years running core training groups. At this point, I'm not sure whether I'm going to start another one or not, but I also run, as you know, I have several monthly small groups that meet once a month, and I get a lot of pleasure out of doing it. Most of my extra time for the last 5 years has been involved in working on 2 books. One is mine with 2 co-writers. The other is one of my co-writers, Nicole Rader-Lamberg, who's doing a second volume. These are big books, and we hope that they will be worthwhile additions to the ISTDP community. Cannot wait for them to be finished. They've been going on and on and on.
We are also waiting to be able to translate them and to publish in Polish language. And we do hope that, who knows, maybe because of this new AI approach, we'll be able to publish as soon as possible. Of course, the idea to publish them by the conference in Warsaw, 2025 September, would be almost impossible, but who knows?
We're hoping to be able to have the books published by the summer. So that was before the conference.
It's always a pleasure to understand, to learn the model, and then to implement the proper translation. So it's always a pleasure. You mentioned about teaching and running co-trainings. We see with our students as well, those ups and downs, and people are most of the time in crisis. What would be your advice for our students that are going through the 3 years co-training process?
That's not easy to answer because, you see, the crisis can be generated by several different factors. One of them is the difficulty of the model itself, which pretty much everyone will say is difficult to learn. but also you have a lot of people who are struggling with their own emotional difficulties. And so they have to take care of that part. They hopefully are in therapy, getting help with and regulating themselves so that their unconscious can be free to work effectively with the unconscious of the patient. And neurosis is common. I mean, we all have our neuroses to different degrees, but there are also people in the field who are fragile. And so their difficulties with learning this will be greater. But fragility can be helped enormously if they go and get help for it. So that's something that I've always been very direct in speaking to students about. I would learn that they were in a lot of pain, that something was not going well in their own personal life. And I would encourage them to get help for it. And I say, if you get help, it will help you not only with your struggles as a person, but it might also very much help you to learn to be a more effective therapist. But I think that's something that we have to address. There are many people who come into the field who have problems.
This wounded healer concept from Carl Gustav Jung, that most of wounded healers, people that either got some kind of a broken heart, longings coming into field of helping others. Don't you think so about it?
Oh, absolutely. I'm just laughing because I'm remembering, Dr. Davanloo saying that the most common source of struggle in life, or the most common form of illness, is not the common cold. He said it's human neurosis. He said more people struggle with neurosis than any other kind of problem.
Yeah. And we see and we recognize that this is number one disease, not heart problems, but anxiety, depression. It is growing, it's on the rise. And then people will finish co-training and then they will go back to their practice, because most of our participants, they already been working with patients. They've been already psychotherapists working with other patients. And then based on your knowledge, on your experience, could you share what could happen? So how has ISTDP shaped your clinical approach and broader career path? In what ways it has been most transformative for you?
I mean, in many ways, I think the whole way in which I understand how we approach the work at the very beginning changed dramatically when I listened to Dr. Davanloo say that doing the standard psychiatric history at the beginning is not going to be helpful, because memory is fallible. People filter their memories through projection, repression, other mechanisms. And so getting an accurate history is not possible. So he changed the way in which we approached the work right at the very beginning with what he called establishing a psychodiagnostic understanding. And so you're looking at the anxiety pathways, you're looking at the degree of structure or lack of structure that the psyche has at the beginning. You're looking at the responsivity that the patient has when we pressure. Do we see that pressure activates anxiety? Do we see that pressure activates more defense? If it does, we know that we're going in the right direction and that the patient is probably going to be a good candidate for the therapy. But this is the way in which I approach my understanding about working with people today. It all changed with Dr. Davanloo. And, the only true understanding of history comes with the unlocking of the unconscious, where memories come back in a way that people sit there and they're remembering it as though it happened yesterday. Things that they didn't remember, the emotions that were tied with the memory come back. It is a fascinating process. But if I were to pick one part of the work that most strongly impressed me and gave me a desire to learn this, it's what I call the spiritual aspect of what I saw Dr. Davanloo doing. That I watched him take people who had no relationship with, let's say, a mother or a father. There was tremendous trauma that had led to cutting off relationships with people. You see the unlocking, where you see complex feelings that are being generated. And first you're asking them, how would the rage go on me if you unleashed it, if it went further, and if you let it go berserk, how would it go further? And you see the sadisticness and the primitive nature of the rage. But then something fascinating happens. You ask them what they want to do with your dead body, but they're looking at the eyes of the genetic figure, the mother or the father that they had only hatred for. Now they want to hug them. Now they want to say they're sorry. And you see, this is where the healing comes in, where people can let go of the pain. They can oftentimes go out and they say, they'll come back the next session and say, I never had a relationship with my mother. But after we met, I went to talk with my mother and I said, I want to find a way to build a relationship with you. This is not cognitive. This is not artificial. This is not, when therapists sit there and encourage people to find a way to get over their angry feelings. This comes from deep within the unconscious, and it has a healing power. So when I saw this, that probably more than anything else, that's what made me say, this is what I want to learn to do.
So this ability to open people's hearts, and in the central element of the heart is always love.
Well, the heart is activated because of access to grief, the deep yearning for something different. And all of that gets buried underneath psychological trauma. People learn to hate, they learn to blame. And people who blame and hate will never heal.
Yeah. So when you're looking ahead, what do you think about the future of ISTDP?
Oh boy, I knew you were going to ask me that. And there's a part of me that's reluctant to give you an answer because on the one hand, it's discouraging, where I see that there are many people who desperately want to learn the work, and yet they're not able to learn to do it effectively, or maybe a little bit, but not deeply effectively. And it's sometimes difficult to know why it is that way, but I watched it in Montreal also, that everybody up there desperately wanted to learn to do the work, but there were those who did it very well, and there were those who did it very poorly, and then some right in the middle. I think that what I'm seeing is what I would think of as kind of a splintering, where people are going off and they're taking their difficulties and they're trying to find a new way to do the work, but it often takes them in the wrong direction. And they're creating something that's really not consistent with Davanloo and his understanding of the human unconscious. But this was probably going to be no different than, when there was Freud, and then psychoanalysis went in many, many different paths, many people establishing new directions. Some of them proved to be valuable. Others were interesting. In this world, there are not many geniuses. So Habib Davanloo, in my mind, sits next to Freud on the throne. There's a throne with two people, and they're both there together. And without Freud, there would have been no Davanloo. And without Davanloo, there would be no us.
I understand the wishes that ISTDP will stick to the Davanloo model as much as possible.
Well, that's my wish, but that's, I'm only speaking for myself. Other people have their own ideas about where they're going to go with it.
Yeah, we had the same discussion with Case Cornelissen, and he has exactly the same approach that, yes, we are guardians of Habib Davanloo work. The same I hear when we are speaking about ISTDP with Josette. She is always referring, okay, this is not a different way. This is ISTDP.
These are all very, very intelligent and creative people. I mean, I know some of them. What I know is that they're going to keep a faithfulness to the core principles that they outline. But there's a lot of freedom to use them differently based on our own personalities. So it doesn't mean that we all have to look like Habib Davanloo in the way in which we work. We wouldn't be good if we did that. We have to be true to ourselves, but we have to work with a model. The model has what we call the central dynamic sequence. It is faithful to the understanding of why we use pressure, why we need clarification, why we need challenge, how we head-on collide in the transference and breakthrough into the unconscious. It's a sequence. And I think that if we have to follow the sequence faithfully, but there's a lot of flexibility in how we can do it.
Is there anything, John, about your journey or perspective that you would like to share with our EDT colleagues?
I think that a concluding thought is that this is a journey. And, for me, it's a lifetime journey. I don't think that I learned everything in my 22 or 23 years of being up in Montreal. I continue to grow. I continue to learn. At least I try to. And it's a fascinating journey. It's filled with inspiration. When you see the way in which people change, it gives joy, not only to the patient, but to us as the therapist. And so this would be this is the legacy that Dr. Davanloo has passed on. He's given us a gift. And it's something that can give us a rich life, a fascinating life.
I remember Robert Polskie always saying to our students, be careful because this is the most addictive model ever.
He's right. He's right. Although the most addictive model ever, I don't know. I think people want to believe in whatever they do. So I probably talked to a cognitive behavior therapist, and they believe it is the road to healing. And I know some behaviorists, they think their way is the right way. Everybody wants to believe that they have the way that makes the most. It gives them a sense of purpose when they get up in the morning.
Yeah, addiction probably was about that for us, people studying ISTDP is something that you want to, always hungry to learn more and to solve those mysteries of our patients. And we've got those tools to be able to help them in probably most efficient way. For me, it was till this moment, I didn't find anything else that was so effective, so efficient. That's maybe just my perspective.
I remember in graduate school, reading Wilhelm Reich's character analysis, and I thought, this man has the essence of understanding what needs to be done to help people. But his way of doing it, he didn't have a systematic way. So I always lamented the fact that he never got to see Davanloo, because he probably would have said, Davanloo developed a way of achieving the very results that he had hoped for, with this concept of character armoring. Now, Davanloo never called it character armoring, but that's really what he was talking about.
Finally, we would like to invite our colleagues to our next conference in Warsaw, and also then your supervision that will happen a week after.
I look forward to being there. I'm very grateful to you for inviting me. And I know some of the people who will be there, and others I don't know. I know of them. So I think it will be a very exciting time for all of us, and a lot of nice people, a lot of talented people, and hopefully a lot of interesting videos that we're going to watch. I hope that there will be people who decide to join us.
Thank you so much. And we are looking forward to meet you in person, to see your work, and also to get advice from you in a couple months. Thank you.
I look forward to being there. Thank you.
Thank you.